I'm Dr. Ashwini Avashiti, and today we are here to discuss long COVID-19. As we all know, most people who have had the novel coronavirus 2019 recover completely within a few weeks. But some people, even those who have had very mild symptoms or versions of the disease, continue to experience certain symptoms even after the initial recovery. These symptoms may last sometimes for a few weeks to few months too. These people are called as long haulers, and the conditions sometimes is called as post COVID-19 syndrome or long COVID-19. These health issues are also called, are generally considered to be the effects of the COVID-19 virus that persists for more than 4 weeks after you've been diagnosed with it. Most commonly, older people and people with more serious comorbidities or medical conditions are the ones who are likely to experience long lingering symptoms of the virus. But it has been noted that even the young, otherwise healthy population can feel unwell for weeks to continue even after the initial recovery of the infection. Common signs and symptoms that linger for a long time after your initial recovery will include fatigue, shortness of breath, dyspnea on slightest of exertion, or difficulty in breathing, either on a regular basis or on and off. Other symptoms might include cough, which can be long lasting, multiple joint pains, body pains, muscle pains, headaches, etc. Chest pains have been also seen to be lasting for some time, and hence it is very important to rule out the other causes of chest pain before you term it as a post-COVID-19 side effect. Muscle pains and headaches are very common. Other symptoms include palpitations, loss of smell and taste. This has been a very common symptom of the long COVID, which has been seen in patients, in my personal experience, at least around lasting for 4 to 6 months, where people just do not understand the taste of the food they eat, cannot smell anything, and actually there's no treatment for this. So it's just time that has to go. Another things which include is memory, concentration, and sleep problems with depression or anxiety issues. There can be fever which can long for a long time, maybe a month or a month and a half or so. But before you term it as long COVID-19, you have to rule out with workup, making sure that there's no other cause of fever going behind it. Dizziness or postural vertigo is also noticed a lot. One of the main big group of long COVID-19 symptoms or post-COVID-19 side effects includes organ damage caused by the virus. Although COVID-19 is seen as a disease that primarily affects the lungs, it can also damage many other organs, including the liver, kidney, brain, heart. Organ damage may lead to the other health complications that linger for a long time after the virus is cured or recovered. In some people, long-lasting health effects may include, like I said before, breathing problems, heart complications such as artery blockage or multiple blockages in the heart, or things like cardiac embolism, cardioembolic strokes. Chronic kidney impairment has also been seen in patients who have been hospitalized for a long term with use of too many medicines for the other complications that developed during the COVID-19 infection. Another very important disease seen in a small number of patients, but a very important one, is Guillain-Barré syndrome. That is a condition that causes temporary paralysis. Some adults and children may and might have also experienced multi-system inflammatory syndrome, in which many organs become severely inflamed and affected. So blood vessel clotting, another big problem. Like I said before, COVID-19, when in the initial stage, whether in the recovery, it causes the blood cells more likely to clump, aggregate, and form clots. While large clots can cause heart attacks and strokes, small clots blocking the tiny blood vessels of in the body anywhere can cause symptoms like digital gangrene, vasculitis, DVT, that is deep venous thrombosis, leading to pulmonary embolism. Other parts of the body which also can be affected by blood clots include the lungs, that is leading to pulmonary embolism, liver, and kidneys. Hence, we need the people who have been infected with COVID-19 in a moderate to severe form also need to get themselves checked for a after a regular certain interval for some time till we get out of all the long COVID symptoms. The major thing which has been seen in the younger population or people who have had symptoms of COVID-19 which were severe, needed ICU admission and treatment in the intensive unit with mechanical assistance for breathing, such as the ventilators or NIVs or high flow oxygen concentrators. These people have developed a, a level of depression or anxiety symptoms, severe problems with mood swings and fatigue. Simply surviving the experience can make a person likely to develop later symptoms of post traumatic stress disorder, depression, and anxiety. Because it is difficult to predict the long term outcomes of the new COVID 19 virus, we are looking at the long term effects or results in related viruses too, so that we can correlate with the new virus and work in a way to help people or patients who are suffering from it. Many people who have recovered from COVID 19 have gone into chronic fatigue syndrome and complex disorders characterized by extreme fatigue that worsens with any kind of mental or physical activity. Many long term COVID 19 symptoms still are yet unknown to us. We will come to know them as over time as people come to us with symptoms and we work it up. But research is going on. There are many large medical centers opening up to provide specialized care and clinics to the people or patients suffering from long COVID 19. So our patients or our colleagues or any one of us who has these symptoms should take advantage of these centers, go through it, because every other physical symptom can be treated with medicines, but the major long COVID-19 or the post COVID-19 symptom, that is anxiety, depression, needs to be tackled initially so that you don't worsen, and this can happen only when you speak it out and counsel. At the end of it, though, what we can summarize is it is important to remember that most people who have had COVID 19 recover quickly, but the potentially long lasting problems make it even more important to reduce the spread of COVID 19 by the known, done, and trusted methods of wearing a mask, avoiding social gathering, maintaining social distancing, which we've been doing for a long time and we should be prepared to be doing in the future as well, so that we are all protected and defeat the COVID-19 once and for all. So that's it for today. Thanks a lot for joining in. Hope you liked the session.